Good afternoon, my name's Jeff. Just covering off on my practical component for special populations with three conditions, that being high blood pressure, lower back pain and a knee injury. So if we just look at these individually, with high blood pressure, description, otherwise known as hypertension, where the blood pumps through the veins at a higher pressure than normal. A contraindication of this might be that they've come from an allied health professional and that their instructions are that they can't get their heart rate up too high. So we need to look at this and modify it. We want to avoid a situation like a stroke or a heart attack or an aneurysm. So when talking about the exercises involved, which were the cross trainer, the treadmill and boxing, we'll need to look at how to modify these. Obviously one of the first things we're going to do is limit the intensity of it and have more breaks. Some other things that we might do on the cross trainer is take our hands off the arms of the cross trainer, therefore just have them in a static hold on those two handles there, so therefore we're only using the legs. So we're going to reduce the heart rate, therefore not push our blood pressure up too high. On the rower, shorter strokes, just coming in and out very shortly, not doing that full range of rowing where it's really good exertion on the body, so we don't want that. And boxing, we would just probably limit the time on that and the intensity, so shorter, softer punching with more rapid perhaps, but not the big heavy punching that's going to really put pressure on the heart and push the blood pressure up. So that's covered off on the high blood pressure. Okay, lower back pain. Now this could be from an injury or a lack of mobility. As we get older, we get a little bit less mobile, and lots of people come across lower back pain. A contraindication with the lower back pain as far as the boxing and rowing and cross trainer are concerned is, that they might have had a suggestion from the allied health professional that they can't put too much pressure on the back. Now with the cross trainer, it's pretty good, really not going to be exerting too much there. We've got a low impact machine, so that's not too bad. With the rower, yeah, if we're going to go full motion, that is really going to put a strain on the lower back, so we'd have to look to modify that. Boxing, you just have to take it easy. So with the modifications on the rower, we would look for a shorter stroke, as I said before. We don't want that full lean forward and engaging that lower back. Probably in reality the best to avoid the rower, I would think. Boxing, similar as before, keep shorter, sharper punches. Don't want to be aggravating that lower back at all, and a little movement as well. So keep the feet planted, just concentrate on upper body. Cross trainer shouldn't really aggravate the back too much. Just keep the hands probably static as well on that one. Okay, special populations, knee injury. Now this could be from surgery or recovery from a reconstruction, for example. It could be simple knee strain, or it could be a knee replacement. A contraindication for this is that they've come from their allied health professional and they say, right, you can't put too much pressure on their knee. So example, running, squats would be out. You need to do low impact exercises. So a contraindication of this is that we need to take care of the injured knee and not re-injure it or not push it too fast, with the view in mind that we don't want to, re-aggravate that injury, injure it further. So some modifications we could use on this. Cross trainers, again, pretty low impact. It really shouldn't, unless it's hurting that person's knee while they're going through that motion, it's really a set motion each time, so we can't really modify that. So if that was fine, we can't really do any modifications, just go with that. With the rower, definitely need to watch the knees on that. As you're going through a full motion on the rower, you were bringing your chest up towards your knees. Now that's going to get it past the 90-degree bend, so we would have to modify that into shorter strokes. Boxing, use the upper body only, no lateral movement, and definitely no squats like a duck or things like that. But yeah, just probably get their feet planted, get them to use their arms and body. With a lot of boxing, if you're doing it properly, it does involve, hip and knee movement to throw the punches, not just with your arms. So for this case, we would just get that person to use their arms. Okay, that finishes off my assignment on special populations. Thank you.